past. So basically what they do is they can go through large amounts of data, come up with decision making, make decision making quicker. And they cannot replace the health professional, of course. They cannot replace a doctor or a specialist or whatever role they will have to play, but they can certainly assist them in making the decision making process more efficient.
Greetings, ladies and gentlemen. Today it is an honor and a pleasure for me to introduce you all to this very particular session where we are going to know more about the post-COVID healthcare industry in India, challenges and opportunities. My name is Harsh and I'm going to moderate this session for all of you, wherein I'm going to introduce you all about the event and perhaps the person who is going to interact and address all of us. First of all, I request you all to kindly acknowledge and welcome the presence of our esteemed guest, Madam Urvashi Prasad, who is here with us. I would like to request all the persons, those who are watching this session on YouTube, to kindly upload in the comment section and welcome the presence of our guest. Madam Urvashi Prasad has extensive experience in health, nutrition, gender, and public policy. Over the last 5 years, she has been working as a public policy specialist in the Office of Vice Chairman at NITI Aayog, which is the premier policy think tank of the Indian government. She is currently part of the core team supporting the work of Government of India's Empowered Group 1 for managing the COVID-19 pandemic in the country. Madam Urvashi is a member of the task force for overseeing implementation of sustainable development goals in India and co-authored India's first voluntary national review presented at the United Nations High-Level Political Forum on Sustainable Development in the year 2017. So first of all, ma'am, I welcome you to in this session. Thank you so much for joining and agreeing to share.
Thank you.
Thank you so much, ma'am. So,
Thank you.
The COVID-19 pandemic has led to a dramatic loss of human life worldwide and presented an unprecedented challenges to public health, food systems, and the world of work. The economic and social disruption caused by the pandemic is devastating. Ma'am, may I request you to please tell our viewers how actually this COVID-19 or how hard this COVID-19 hit the Indian healthcare system, Sustainable Development Goal 3?
It had a very wide-ranging impact in different ways, but a lot of it was sort of unearthing and revealing the challenges that we had in the past as well. So we already had a lot of challenges with the health system. There's a lot of inequities across the country. States are at different levels of development, not just in terms of the physical infrastructure, but also the human resource availability. So all of that sort of got further highlighted during the pandemic. And of course, challenges related to behavior change and public health and hygiene behaviors, which is something that, the population here, we had to really create awareness. That was not something that really existed at scale before. So those were, challenges which were there in the past as well, and which got sort of exacerbated at this stage. So now, the pandemic then further disrupted, a lot of the health system activities. Because a lot of the resources had to be diverted towards COVID. So a lot of the other essential health services, the maternal, reproductive, child health services, the non-communicable disease screening for TB, etc., all of that got impacted. So I think those were additional challenges which brought about, which sort of came from the pandemic. But then there were a lot of the other ones which were pre-existing, and the pandemic just sort of highlighted those. So I think the impact was, of course, wide-ranging, but it wasn't all challenges. There were some opportunities that have also come out of this. So, for instance, in digital health, telemedicine, these are some of the opportunity areas that have also come out from this pandemic. The adoption of telemedicine went up in a big way during this time, but a lot of it was limited to our metros or to our tier 1 cities. So there's still a lot of scope and need for us to sort of go beyond this into tier 2, tier 3 cities, rural areas, etc. But at least we did see a lot of acceleration in terms of adoption of digital health and telemedicine. So that was also an opportunity, and not just the challenges that have come from this.
Indeed, ma'am. I think you have given a very detailed overview, and I think the viewers, those who are watching this session, they are surely going to understand these things and how we have seen the mass adoption of telemedicine during this pandemic. Ma'am, my next question to you is: artificial intelligence and robotics are making advance across the healthcare industry, from genetic testing and robotic surgery to cancer research and data collection. In dermatology, AI is already used in practical terms where it is used to detect skin cancers through an experimental mobile version of it by medical professionals. Ma'am, may I request you to tell our viewers how actually AI and robotics are transforming the healthcare?
So I think these technologies, the advantages are basically that they can go through large amounts of data and try and develop some, predictive capabilities. At least some of these technologies allow you to do that. So, you can go through health records of patients, and you can come up with what sort of treatment might work better for one versus the other, or you can make a diagnosis more quickly based on their health records from the past. So basically, what they do is they can go through large amounts of data, come up with decision making, make decision making quicker, and they cannot replace the health professional. Of course, they cannot replace a doctor or a specialist or whatever role they will have to play, but they can certainly assist them in making the decision making process more efficient. So that is what a lot of them do. I mean, there's different variations to these technologies and different applications, but in a nutshell, a lot of them try to do this. And of course, in India, there is a lot of scope for that, because we have a shortage of doctors, specialists, other health professionals, especially in rural areas. So we do need to use these technologies to try and enable decision making. That's also where something like telemedicine, as I said already, it can help to address some of the HR shortages, but it can't be a substitute. That's very important to remember, because sometimes we can sort of get carried away with the technology bit of it and forget the human resource and the behavioral aspects, etc. So I think there is a lot of potential, but it's still at a nascent stage in the healthcare space in terms of use at scale. So there are pilots, there are some startups which are doing very innovative work, but to scale all of this up, you need an entire ecosystem to be working, which, as I said, needs to also look at the behavioral aspects, and also the costs, also acceptability, cultural factors, because you can have the most advanced technology, but it might not work in a particular context. So I think the context becomes very, very important here as well. So I think that's. But as I said, that the pandemic is certainly going to accelerate a lot of these things, which in the past have been adopted more slowly. Now people will sort of come over their initial inertia and adopt them in a much quicker way. But we need to provide that entire enabling ecosystem. That is a must, because without that, it's not going to really take off in the way we want it to.
Indeed, ma'am. Again, it was a quite insightful answer from your side. And as you have mentioned, that technology is not going to replace the doctor or medical professionals; it is only going to assist. And I think we need to understand this point. Because my next question to you is: how do you see the future of medical tourism in India?
So medical tourism actually, again, it's an area with there's a lot of potential, and even before the pandemic, we were increasingly preferred location for patients from several countries. But of course, the main reason that the biggest driver has been our lower cost of various procedures, surgical procedures, various other procedures. So that has so far been the biggest driver of medical tourism, or why patients have come here, because you can get a surgery done here at 1/5, 1/6 the cost of what it might be in another country. So in fact, even during the pandemic, we kept seeing such patients coming here. And that, that was not really disrupted to the extent that we thought it might be. Of course, the sector has taken a hit, but it's not been as much as we thought, because people have still come here for other essential life-saving surgeries. But the other big segment that we have a huge potential is the whole Ayush wellness tourism segment, and especially in the post-COVID world, where you will, have a lot of stress-related issues, a lot of chronic issues worsening, perhaps. This is a segment that we need to exploit the potential of much more, because, our Ayurveda, yoga, etc., these are inherently geared up towards stress reduction, towards holistic, well-being, wellness. So I think all of these things we'll need to capitalize on further now in this post-COVID world. But I think it, of course, cannot happen at the cost of our own health system and serving our own population. So we need to keep a focus on that. But we need to develop this segment, because it can certainly generate a lot of jobs. It can get the economy much needed boost as well. And countries like Thailand, etc., are doing very well. There's no reason why we can't. So, of course, we should look at it very seriously, but it shouldn't be at the cost of, obviously, the critical services we need to provide to our own population.
Indeed, ma'am. I think it's a very great message you have given. And ma'am, my next question to you is: the healthcare industry remains one of the biggest opportunities for entrepreneurs and investors. Innovative startups are utilizing new technologies to offer solutions that improve quality, lower cost, and streamline access to healthcare services. Ma'am, how do you see the future of entrepreneurship in healthcare in the next 10 years?
Yeah, so it's a very vibrant space, and even during the pandemic, a lot of startups played a very big role. We had innovations across the board, right from robots which can do sanitization of public places, hospitals, to those who can deliver food and medicines to patients in hospital wards remotely, to remote ICUs, to all sorts of applications which can track and monitor people in quarantine. So we had technology across the board. Of course, diagnostics, many startups played a very big role there in scaling up your RT-PCR tests, and scaling up your rapid antigen tests. All of that, the private sector entrepreneurship played a very big role in manufacturing our PPE kits. We were virtually manufacturing 0 PPE kits at the start of the pandemic. And now we can manufacture at least 450,000 PPE kits every day. So that, the masks that we manufacture, the ventilators. So at every level, it's been, private sector playing a big role, and also partnering with the government. So I think there's a lot of potential in different segments. We've already spoken about digital health being one of the segments, but it's in pharma, it's in medtech, it's in a whole range of areas where we need entrepreneurship, we need innovations, and of course the government is trying to support that as well. So as part of the Atmanirbhar Bharat package, performance-linked schemes have been announced for boosting domestic manufacturing and innovation in the pharma, medtech areas. So vaccines, of course, we are seeing, India is playing a very, very big role. Over 92 countries have already approached us for the COVID vaccine. And there's so much more potential, untapped potential in each of these areas. So I think definitely entrepreneurship is going to play a big role. And of course, government is trying to and has a very important role to play in putting in that enabling ecosystem.
All right, ma'am. Again, it was a quite insightful answer from your side. And as you have mentioned, that government is promoting the entrepreneurship and make in India, or you can say the self-reliant making to make India self-reliant. We have seen that in past years, government have settled many incubation centers in different part of the regions to promote these entrepreneurship kind of things. Ma'am, my next question to you is: telemedicine increases patient engagement by helping maintain checkup appointments and care schedules. Virtual consultation make it easier for patients to reach out to their physicians, report early warning signs or any health concerns, follow on through their appointments. What are your thoughts on the emerging telemedicine towards a holistic digital ecosystem in India? How do you see what are the advantages and what are its disadvantages?
So telemedicine, I mean, we've spoken about it already, but I would just say that it's more than disadvantage. It's what do we need to make it scale up, and I think that has different elements, because in rural areas it's very different from trying to scale it up in a large metropolitan or in a tier one city. So we need to look at the different contexts, obviously, as always in something like this, and then look at the potential of this, technology in that context. Overall, yes, it has a lot of potential because, as I said, we have shortage of quality health professionals in different areas. So if you can use telemedicine to provide that kind of advice to people remotely in their homes, it also, home healthcare is actually another segment that is worth looking at now, more so after the pandemic, where people have had to adhere to physical distancing norms. They could not go to health facilities in person. So home healthcare as an entire segment is also has a lot of potential now, and telemedicine is, of course, one part of it. Also because we have an increasing elderly population now. It's not just all young people, but we actually have an increasing number of senior citizens, and also, of course, a very high burden of chronic diseases. So all of that makes it very conducive to look at home healthcare, to look at remote consultations, monitoring. But as I said, it has to be done, depending on the context. People in a big city might be much more comfortable, much more used to doing something like that. But in a rural area, people might still not, they might still have certain reservations. So it's both addressing the technological challenges itself, as well as addressing the human and behavioral and acceptance related challenges. So I think it's not a disadvantage, but it's that we need to do a lot to scale it up across the country. It still remains limited to some of our larger to mid-size centers, but to scale it up across the country needs a lot more effort.
All right, ma'am. Today, I can say there's a lot to learn from you, but today I don't want to take you much time. So, moving to my last question of this session, as you have mentioned that after taking the lead on the supply of hydrochloroquine, India is now on a way to become the coronavirus vaccine hub to save humanity against the COVID-19 infection. How do you see the role, leadership, and entrepreneurship of Indian pharmaceuticals firm in fight against COVID-19 pandemic?
Yeah, so actually throughout the pandemic, we have, whenever we have, reached a situation where we have enough for our own population, be it with, medicines, be it with PPE kits, with masks, with ventilators, because initially we ourselves had, shortages. We were not producing enough for our own population. But once that ramped up, we have consistently tried to help others, our neighboring region, even beyond that. So that is the same sort of philosophy that we've taken forward with the vaccine, that of course our own domestic population has to take priority. But whenever we can help others, we should, because ultimately a vaccine in a pandemic situation is a global public good. You cannot think that, okay, I'll keep it all for myself and we'll be able to bring an end to the pandemic, because a case, a strain, a mutation anywhere in the world remains a threat to every single country. So I think one cannot think of this in very narrow terms as I'll just vaccinate my own population and then I'm sort of sorted, because very quickly the virus can be introduced from someone coming in from another region, another country. So given this philosophy, given that it's a global public good, we have tried to extend our help to various countries. As I said, 92 countries at least have already approached us for the vaccine. We provided a large number of doses to many countries. And of course, these efforts will continue as newer vaccines also come in, because then our options will expand. We might have a single dose vaccine coming in. We might have a nasal vaccine coming in. There's a lot of innovations happening. So it'll become even easier in that situation to not only vaccinate our domestic population, but also to help others. So I think that's something that it's good that we are playing a leading sort of role in this, because countries which are thinking of it a little more selfishly, it's not the right approach, especially in a pandemic. Because as I said, it's a threat is for all of us. It's not just one part of the world or the other.
All right, ma'am. It was really a very wonderful message from your side, and I must say it was a wonderful discussion with you over the topic. Thank you so much, ma'am, for joining and giving your
Thank you.
important time. Thank you, ma'am.
On the ground is where I stand. Never give up, that was always the plan. It's so cold outside. I'm alone, I'm alright. It's so cold outside. I'm alone.